This podcast is brought to you by Delta Neural Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneuralhealth.com. Hey everyone, welcome back to the Neural Health broadcast. I'm your host, Dr. Kappas, and today we are joined by Dr. Jimisha Patel of Thrive Pediatrics. Thank you for joining me today.
Thank you for having me today.
And I'm really excited to get to talk with you for both our listeners and also for personal selfish reasons, as you know, we are about to need pediatric care very soon. For those listeners who have been following along, we're expecting our baby. But Dr. Patel, you have a great clinical history and a great practice that I really wanted our listeners to learn more about. So,
Thank you.
so would you mind telling us just a little bit about kind of your medical back, or I guess your medical practice background and why you decided to open up this concierge pediatric care?
Yeah. So I am a board certified pediatrician, and after I completed residency, I started working at the urgent cares, which I was there for about 5 years, and then I had my kids, and then I switched over to primary care at a different hospital and worked there for another 5 years, and so over like 10 years of experience working, as a pediatrician. And in these medical environments, I found, I was working with insurance based, like your typical medical practices, your model where patients use their insurance, and we're and with that model, you're seeing, as a pediatrician, I was seeing close to anywhere between like 20, 25, 30, sometimes 40 patients in a day.
Mhm.
And it became a lot. It was rewarding to help, of course, help families and stuff, but I just felt like I wasn't getting enough time with them. And I didn't think I realized that really until COVID hit. And when COVID hit, not as many families were coming in to be seen in the clinics and stuff, rightfully so. Because everyone was supposed to stay home, and there wasn't a lot of exposures and stuff, and actually during that time not a lot of people were getting sick. And so anyway, so when families would come in, I would be able to spend time with them, and that was like the first time, I think, in my career where I was able to spend like an hour with my these families, and I got to know them at a personal level. I got to know, about the children and how, their values and what was important to them, and really understood basically their problems. And instead of coming in for just going through the depression checklist, I was able to ask more questions and kind of be like, okay, well, when did this start? What happened? Like, this isn't something that just, like, yeah, I'm depressed one day. Like, something kind of led to it. And so I was able to like dive in deeper. I was able to connect with these families, and it was so rewarding.
Mhm.
I just felt like I that's where I felt like I was making a difference. I felt like the parents and the families were actually seeing I was seeing a difference too in these patients. And
Mhm.
I felt like it was more than just like, here's your medicine, and I'll see you at your next visit. It was there was more we were able to actually fix things, I felt like, because I had time to do it.
Mhm.
And so then I learned about it's called direct primary care, DPC. And so direct primary care has been around for over like a little over 10 years, I believe. It's fairly new in the medical field. And it's where physicians kind of take this the practicing medicine into their own hands, and they take the insurance out of it. And
Mhm.
so you are you're directly paying your doctor, but you're having more time with your doctor. You're building more of a connection with your doctor. And so once I learned about this, and with my experience like during COVID, I was like, I really think this is where my calling is. This is where I'm
Mhm.
going to feel the most satisfaction, and I feel like this is where I will do the most I can help the most kids and families by practicing this way. And so then became I opened up Thrive Pediatrics Concierge
Mhm.
Clinic. And so that's it's basically it's like a membership base. You pay a month or every month, but and the pricing is based off the age of the child, but you pay every month, and with that includes unlimited visits, unlimited communication directly with me. And the visits can be sick visits, they can be well child visits, they can be just a weight check, they can be,
Mhm.
I am worried, let's talk about my kids having issues at school. I'm worried about depression, I'm worried about bullying, like anything. Like I that is so satisfying to me, to have that connection and that trust with patients. Um, and it's not only satisfying because I'm not seeing as many patients today, I don't feel rushed, but it's satisfying because I feel like that's where I'm making the most difference, and I am helping the most. Like I don't like practicing medicine where I'm just like slapping a band-aid on it and then being
Mhm.
like, okay, okay, get out the door. I need to see the next person. Like that is not that's not how we that's not how I want to practice medicine. So that's the reason why I have opened up Thrive Pediatrics.
Yeah. And I think you're solving a problem that is just pervasive throughout the healthcare system right now. I think one of the biggest complaints that I hear from patients is, I waited 2 months to finally see this doctor, and I got to spend 5 to 15 minutes with them, and there was no resolution. There was no that, all that time. They just didn't have any time to dive into their problems, and it's so
Exactly.
sad. Yeah.
Exactly. And so it's like you're waiting for so long to be seen with the doctor. And then when you are like after waiting, like you said, 2, 3 weeks, months, like you get 15 minutes to spend with
Hmm.
that doctor. And I just feel like, with this model, I don't have to see as many patients, so I can see these patients a lot sooner,
Hmm.
and I can, and it's not even like we can talk for an hour, but if you forgot to mention something, it's not like the end of the world where you have to wait, again to communicate with me or get in with me. Not only that, but you can text me directly and be like, "Oh, Dr. Patel, I forgot to mention this about Jimmy," and so it's that stress-free care where you don't feel like you have to be rushed, you don't feel like, you can't get in, you have to get all your like you have to write down all your questions and get them all answered at that time. Like it's more relaxed. It's more of like that trusting relationship. You can call anytime, you can text anytime with questions or concerns. And especially for you guys, the families who are first time parents, like after becoming a mom myself, first time parent, like I thought, I'm a pediatrician, I got it handled, but going through it is completely different. Like
Hmm.
I completely understand like all the questions that you have, all the worries, all the, like, is this okay? Like, the baby's like has hiccups all the time. Like, is this normal? Is there something wrong? Like, I get that now. I felt it and I
Hmm.
understand. And having that, having that access to your doctor where you can just text and, and get reassured at that moment is so, just so nice.
Yeah. And I think because people do often have those long wait times, they tend to go to Dr. Google, right? And
Yes.
Dr. Google may make you panic and it may not be relevant to your situation.
Yes.
Whereas if you could be in communication consistently with your provider.
Yes, and no, and then Doctor Google says, "Oh, Jimmy has this condition," and then you go to the ER or you go to the urgent care, you're like, "Oh
Hmm.
my gosh,"
Hmm.
and now your child has been exposed to multiple other children with illnesses, and
Right.
it's not how the system should be.
Yeah. And the ER is designed for those emergency situations, but the ER is not designed for something that's, while it's causing harm or struggle for the child, it may not be an emergency type situation. There
Right,
may be, some things we need to dig deeper on, which is
right.
where you would come in. Yeah.
Yeah, exactly, exactly. It's just stuff that like, most my husband is an emergency medicine doctor actually,
Mm,
and he often tells me like I've seen multiple people today, patients coming in today that probably could have just been seen by their primary care doctor but
mm,
couldn't get into their primary care doctor
yeah.
for whatever reason, and it's just easier for them to go to the emergency room, and it's sad that that's where our healthcare system is right now, and um, yeah, so I think this will be, for families that are able to be a part of Thrive Pediatrics or, have are able to, and I think it's pretty affordable, but like I think this is a good option for
Hmm.
families, not only for the care, but just like busy families too. Like if you
Yeah.
don't have time to wait or you don't have time to take off work or, anything like that. This is supposed to be more convenient.
Yeah, I would agree. And another thing on the emergency room, I mean, if you're using the emergency room as your primary care physician, you're bogging down the emergency room from people who, really need an emergency situation.
Exactly.
So it just helps everybody.
Yeah. Yeah.
Um, with kind of the current climate and landscape of parenting and growing up as a child right now, it seems like neurodevelopmental disorders are on the rise, so many things that maybe parents wouldn't have had to contend with 20, 40, 50, 100 years ago. Sure, they're dealing with different problems 100 years ago, but the
Mhm.
problems that we're dealing with today, how do your services really help tackle those types of situations?
Yeah. So by being able to spend time with families and being able to do better screenings and ask more questions, I think, I can help, guide families to appropriate services if there are concerns, developmental concerns or anything like that. But not only that, but there's also anticipatory guidance too. So like for example, I can, from the beginning, I make sure I take the time to talk about the importance of screen time and limiting screen time and importance of being outside and how that is so good for the development. So
Mhm.
basically stuff to encourage families to, have their children basically thrive, and that's kind of why I named it Thrive Pediatrics
Mhm.
is because that's my focus is to help children and families thrive. And so to be more on the preventive end of it too, and not only with like there's sleep is involved, media is involved, physical activity is involved in that, diet, what you're eating, what you're taking in, all of that is involved in being able to have the time to talk about that with families, not after that there's an issue, but before, like, right
Mhm.
when, as the child is growing up, like, during different milestones, I will say, "Okay, this is what I want you to focus on now. Your child is more social. Let's talk about, what's the best thing to do to help with the social skills or, help with, oh, your child is probably going to be, starting school and introduced to different kids that have like, access to different media. Like let's talk about what's appropriate for media use and all that stuff. So I try to do it before it's an issue, and then, of course, I'm gonna have families that come in with older kids that have that issue, and that is, like I said, having that time to kinda dive in deep. I have had experience where, I've had kids come in who have, issues with anxiety or depression, and I find that after talking to them for a while and, seeing, like, when did it start, what happened, it's like majority of the time it's due to bullying,
Mm,
and these days the bullying happens through social media,
mhm,
and so they're on their like accounts like Snapchat or whatever or Instagram or whatever, and it happens through that, and it's just, just talking about when like going like having that conversation with families too, or children, and talking about, okay, well, what is healthy, what is healthy in terms of like social media, and it's called like digital citizenship, like how
mhm,
should people be talking to you or conversating with you on social media, and what's appropriate, and what this person said, like why do you think they said that, do you think they're feeling how are they feeling about themselves, like
mhm.
usually if someone's feeling bad about themselves, they want you to feel bad about yourself too for, whatever reason. And so kind of like diving deep into that, and having the time to do that is the biggest thing.
Yeah. And I think, I mean, what you're able to do by creating a relationship with your patients, patients are not going to just see you as, you know, I go to Dr. Patel and I get my shot and then I, feel bad and then I go home or like I don't like the pokey. So
Mm,
I'm resistant to that. But now you're creating a relationship and kind of a support system for the child so that they can bring up kind of these issues that are plaguing modern children that would have totally fallen through the cracks under more of a, maybe we'll say, traditional model, right?
right, right. And there have been times during, my visit where the parents will tell me, like, I had no idea that that
Hmm.
was going on, or I had no idea that that happened. And so I do think that's very important, is to have that safe space for families to, be able to feel comfortable enough to talk about stuff like that. And I think the only way to get that is by building that trusting relationship, and that
Hmm.
yeah.
And what would you say the response has been like with parents who have been seeking for something different, and now that you have something different to offer, what's the response been like?
Oh, they've been so grateful.
Mhm.
Just very, very, and like I just hear a lot of positive, like, oh, my child has, ever since they've started seeing you, they're more social, they're not afraid to, do this or do that, or it's been rewarding to hear um how effective it is, um and yeah, I don't think it was actually, I think I didn't realize the effect of it. It was my primary care job that I when I left there, because like I said, during COVID I was there and I had spent time with my families, and really got to know these like children, and some of these families I had no idea that I had the effect that I did until I left, because they were just, you know, like, I guess at that time, like, they were communicating to me like, "Oh my gosh, like, we're not gonna find a doctor like you," or "You have no idea what you have done for us, or how you have helped, and, you listened. You're the only doctor that listened to me." One patient told me that, I remember specifically. She actually is 18 and kind of graduated from, she was going to be leaving the practice too because of her age, but she's like, "Dr. Patel, you were the only doctor that has ever listened to me." And just like something simple like that, like
Mhm.
really helps people, like, and I try, they're not patients, they're people.
Mhm.
Ultimately, we need to
Mhm.
treat them like people.
Yeah.
And I think in the medical field, with all the training that we get, I think by the time we're out in the working field, we look at them as patients and not people.
Mhm.
And that's where I think, if more doctors can look at everyone as just, your patients that come in as people, then I think we can really that's where we can help them the most.
Yeah. Yeah. People are complicated. People have a lot of different needs and like perspectives, and it's hard to kind of, I'll say, cater to those different needs and perspectives if you've only got such a limited time. So it's great that what you offer opens those doors up for them. Um, you've obviously shifted your model away from what people typically expect from a pediatrician. What would you say your hope is on a kind of a grander scale for the future of healthcare in this country?
So I really hope that we shift away from this model of so like right now a lot of doctors, the way they are being I guess like rewarded or bonused or any of that stuff, it's based off how many patients, how productive are you, and how
Hmm.
productive you are is based off how many patients are you seeing in a day, how much basically money are you bringing in
Hmm.
to the system? And so I think instead of having the incentive be based off of how many patients can you see in a day, it should be based off how well are
Hmm.
you taking care of the patients that you are seeing in a
Yeah.
day? How well are you doing that? Are they going, how often are your patients going to the urgent cares or the ERs because it's more convenient for them to be seen
Hmm.
there versus your office? How well are these patients actually getting their treatments and have their treatment or their conditions well controlled, and that way that's why they don't need to be seen in the urgent care ERs because there have better management of their conditions. I think it needs to be more focused on how well the patients are doing
Hmm.
versus how many we're seeing. And that's where I hope medicine will transition into. I
Yeah.
think I think the way we're doing it now is not, I think we're seeing, and not only that, like with patients not getting proper care, but then physicians are getting burned out more too because they're being asked to do more and more and more. And it can be hard. It can be very, very hard, especially at least, if I saw a patient and had my focus was seeing on as many patients as I was required to see, and then something happened to that patient, like that is a lot of guilt. Like, I would feel so bad that I missed something because I was too focused on getting to the next patient. And then that really does lead to more burnout.
Hmm. Yeah. Yeah, that factory model seems to work well for cars, but maybe not as well for people. Yeah.
No.
Yeah. And what role do you think insurance companies or insurance has to play in all of this as well?
A big role,
Hmm. Yeah.
unfortunately.
Yeah.
Unfortunately, a very big role. I feel like insurance companies, the reason why we, as physicians, are having to see as many patients as we do or have our incentives based off what we do is because of insurance companies. They have a lot of control
Mhm.
over how, doctors practice, hospitals practice. They went from being the middleman to just like being in control of a lot
Yeah.
of
Hmm.
factors in medicine. And so, and I think as being that powerful, if insurance companies started having more, more like providing incentives to physicians based off of how often are your patients going to the ER? Well, let's give you an incentive. The less, your patients go to the ER or the urgent cares, that's how we're going to bonus you. Like
Mhm.
if the insurance companies started doing that, I think that would be a huge shift to things, just because they have so much control right now, and so if they started using that control for good, I think
Yeah.
that would be huge.
Yeah. And I think so many people that I talk to, they pay an arm and a leg for their insurance. And then when it
Yeah,
comes time for them to need to use their insurance for what really helps them, insurance doesn't really like to cover it. And
yeah,
if they do, they may put up a fight or whatever it is. So,
yeah. Or more physicians need to go into this DPC model,
mhm.
direct primary care. I think if more physicians did do that too, I think then, maybe insurance companies would see like, okay, now they have a competition here and now they need
Yeah.
to change things. And so I think we just need having more physicians in this DPC model too. I mean, not only does it provide better care to patients, but I think it's better for physicians too, because you're not in a model where you're leading to burnout. And especially if you went into medicine to help people, I think this is such a good model because you're actually seeing that. You're seeing that,
Mhm.
and at the same time, you're doing it in a way where you're not feeling like you're going to get burned out. So it's kind of a win-win.
Yeah. Well, this has been fantastic so far, and I love the model that you are employing. I think you're definitely on the right track here. If somebody listening to this wanted to reach out to you and explore your services for their own child, how would they do that?
So you can go to my website at thrivepediatrics.health, or you could even just email me directly at Dr. Patel at thrivepediatrics.health. Yeah, so if anyone is interested in this model or wants to know more about Thrive Pediatrics, or if you're even a physician wanting to know more about DPC, please feel free to contact me.
Awesome. Well, this has been fantastic, Dr. Patel, and I'm excited to see your practice flourish and change the face and the landscape of medicine as we know it. So, thank
Thank
you.
you.
Of
Thank you
course.
so much.
All right, and for everybody else, take care.